Have you ever felt overlooked in a hospital setting? Imagine you are Mrs. Smith, admitted to a bustling city hospital for a routine procedure, only to find yourself entangled in an overwhelming web of chaos. Mrs. Smith entered the hospital with trust, hoping for a smooth journey to recovery. However, the reality of her stay was far from her expectations. Picture the relentless noise, the cacophony of conversations, the incessant beeping of machines, a symphony of sounds with no intermission. The lack of tranquility and privacy only heightened her discomfort, casting a shadow over her recovery process. But the noise was not the only concern. Communication, or rather, the lack of it, added another layer of frustration to her experience. The attending nurses, although experts in their field, seemed preoccupied, their explanations vague, their responses to her concerns dismissive. The absence of clear guidance and support left Mrs. Smith feeling anxious, uncertain, and overlooked. This is not just Mrs. Smith's story. It's a narrative that reverberates across many hospital rooms and corridors. But it doesn't have to be this way. Mrs. Smith's experience serves as a wake-up call, a poignant reminder of the importance of patient-centered care. Prioritizing patient comfort and communication is paramount. It starts with acknowledging the noise levels in the hospital and taking proactive measures to foster a quiet, calming atmosphere conducive to healing. But it goes beyond just reducing noise. Healthcare providers must prioritize effective communication, taking the time to listen to patients, addressing their concerns, and involving them in the decision-making process. By fostering an open dialogue and showing empathy, we can build trust and rapport with patients, enhancing their overall experience and satisfaction. In essence, Mrs. Smith's journey underscores the need for a paradigm shift, a move towards recognizing and addressing the factors that can negatively impact the patient experience. By embracing a patient-centered approach, we can ensure that every patient feels heard, valued, and supported on their path to recovery. In conclusion, Mrs. Smith's story is a powerful testament to the importance of patient-centered care. Her experience serves as a catalyst for change, a beacon guiding us towards a more empathetic, supportive, and patient-focused healthcare experience.